Good evening, everyone. It's a beautiful weekend over here. How is everyone doing? This is Upstream Health with Ify, where at Upstream we learn how to implement healthy behaviors to manage chronic conditions or implement healthy behaviors to prevent chronic conditions. Okay, this is a channel for awareness, not to judge, not to be judgmental. This is a channel to teach, to learn, to encourage one another, to help one another to learn. So, my audience mainly are people who do not understand all the medical jargons. I just want to keep it simple as always. So today we're going to be talking about diabetes. Diabetes is a huge one also. So today I'm going to be educating you guys about diabetes, the cause, the management. I don't want to use the word treatment. Let's say the management, the things you can do to prevent complications if you already have diabetes. Okay, and the things you're supposed to be aware of while managing diabetes. Okay, you can always partner with your primary care provider, okay, and managing diabetes so that it doesn't get complicated, you don't have a worse health outcome. Okay, so I'm gonna turn my camera so that you see a little picture. I'm a visual learner, so I love drawing even if I don't know how to draw properly, or I'm not a professional. So I'm gonna turn my camera so that you can see something. I'm gonna talk about it, so I'll turn my camera so that you can flow along with me. Okay, guys, so this is a little picture that I put up, not so perfect. So some of us call this diabetes type 2. Now, be mindful, I'm only talking about diabetes type 2, which is the most common one you see in adults. So some people know it as diabetes type 2. Some people say hyperglycemia. Some people say my glucose, my sugar is high. Diabetes mellitus type 2, hyperglycemia, glucose, sugar, right? So when someone has diabetes, this is what is going on with the organs of the body. The major organ here is a pancreas. Go back to the video that I put up about the gut and weight loss so that you can see where the pancreas is, right below the liver. So this is the major organ here. Pancreas produces insulin. All right. And insulin is the real deal. The insulin, it's like the vehicle that transports the glucose to the tissues. So let me tell you a simple thing that happens with a normal healthy individual without diabetes. Healthy pancreas produces insulin, which is like the vehicle. The insulin, which is a vehicle, takes the glucose and supplies it to the body tissues, to the muscles, to the adipose tissues, right? Now, that's for a healthy person. For diabetes, there are two things that could be happening, one or both, okay? For one, let's look at the first scenario. Now, Mr. Pancreas is the one faulty. Mr. Pancreas is not producing enough insulin. Example, let's say Mr. Pancreas is producing only 50% insulin, right? So 50% insulin, the vehicle comes here, instead of taking up the 100% glucose, it takes only 50% glucose and takes around the body. So what happens to the remaining 50% glucose? This is just an illustration, all right? So the remaining 50% glucose is hyperglycemia, glucose, diabetes. Oh, my sugar is high. That's the first scenario. The second scenario is Mr. Pancreas is good, functioning properly. It can produce 100% insulin, and it can move 100% insulin. So Mr. Pancreas is healthy, producing 100% insulin. It's able to move 100% of insulin. So now Mr. 100% insulin picks up 100% glucose and comes out of the blood, and it's like, oh, where are the tissues? So 100% insulin. So let's say this is the insulin here, and this is the glucose attached to each other here. And they're looking for the tissues. They're like, oh, we are the tissues. Oh, we are the muscle cells. So the problem here is that the muscles, the adipose tissues, are not able to, are not sensitive to the to this people, to the insulin glucose. Let me put it that way. So that this is what is called insulin sensitivity. So adipose tissue is your body fat, your original, your body fat that keeps you warm, not the excess fat. Now, the adipose tissue, everyone has a percentage of adipose tissue that is healthy for you. So that's the body fat. So your body fat, your muscles are insensitive to the glucose. So what happens? The glucose remains in the blood vessel. That's what we call diabetes type 2, hyperglycemia, glucose. My sugar is high, my glucose is high. So this is what happens here. All right. So let me turn my camera so that I can tell you some few things, and then we'll continue from there. Okay, guys, I hope that simple illustration was helpful for you guys. And so right now I'm going to be talking about when to get tested. Okay, so getting tested can start at the age of puberty, and there are other things to consider before getting tested, like the risk factors. Like if you have a relative, a member, or in a family that has diabetes, you should be getting tested early. All right. And if you're obese or overweight, when your BMI is greater than 25, you should get tested. You should know your numbers. At the age of 30, you should know what your A1C is. So what is A1C? A1C is called hemoglobin A1C. That tells how your glucose has been controlled in 3 months. That's the amount of glucose attached to your blood cell. So when that test is done, they find out your number. So a normal A1C is 5.7, no, below 5.7, and pre-diabetic is 5.7 to 6.4, and diagnostic level is anything about 6.5 and above. So you should know your numbers at this time. Like if you're watching this video and you don't know your A1C, I recommend that you work with your primary care provider to know your A1C, especially if you have the risk factors that I just listed. If you have high blood pressure, you have a risk, it's a risk factor. If you have cholesterol issues, you have a risk factor. We have the good cholesterol, which is called the HDL. If your number is low, you are at risk of diabetes. If you're overweight, your BMI is greater than 25, you are at risk. If a family member has it, you are at risk. If you have, there's what we call metabolic syndrome, like when you have belly fat, okay? And also, I mentioned the rest: hypertension, overweight. And when I say hypertension, it could not be, it shouldn't be that you already diagnosed. If your blood pressure is consistently high, 135 over 80, or over 85, I meant to say, if it's consistently high at 135 over 85, then you should get tested. All right. So those are the risk factors. And talking about A1C, I love using the A1C a lot for my patients. So usually you check that every 3 months, especially if the person is diabetic. So there was a time I saw my primary care doctor and I got tested. I checked my A1C. It was at the pre-diabetic level. It was at, I think, 5.8%. And my doctor told me, Ife, you need to do something. I said, good. So I went back home. I implemented high fiber diet because already on low carbs diet or complex diet. So I went on high fiber diet. I bought flax. I bought fennel. I bought basil seed I put it more in my smoothie. And then I also embarked on intermittent fasting, like eating later in the day. All right, that helped a lot because I went back after 3 months to get tested and it went back to the normal level below 5.7. Okay, so that's what we're talking about here in Upstream. We teach you and you're knowledgeable, you're aware, and when you're speaking to your primary care provider, you're able to partner with them to make important changes to your health so that you can have a better health outcome. Okay, so the next thing we're gonna be talking about is managing diabetes. So it's not just for those who are managing diabetes, but also those who want to prevent it. All right, this is for everybody. So I'm gonna go ahead and take a little break. I need to hydrate. My throat is dry. I'll see you guys in a bit.